On September 8, 2013, the emergency department at Flint River Hospital in rural Macon County was shut down. The following is a report on the impact of this event on the local community.
I'm Blake Christensen.
I'm Caroline Campbell.
I'm Samuel Coffin.
I'm Rayonda Williams.
I am Eric Oliva.
I'm Lacey Williams.
I'm Rob Gasser.
I'm Martin Halachek.
Hadley Heindel.
Trick Leffler.
I'm Brooke Skirmerford.
Matthew Joseph.
I'm Rebecca Anders.
I'm Matt Wynn.
Hi, I'm Sadie Mason.
I'm Minna Choi.
My name is Travis Welsh.
Hi, I'm Min Kwan.
I'm Michael Anderson.
Hey, I'm Sagar Patel, 5, GRU email.
Obi Kalada.
I'm Josh Davis.
I'm Lindsay Williams.
Hi, my name is Mohammed Siraj Qadir.
Our three counties of interest here were Macon County, where the ER was located, Sly County, and Dooley County.
Getting 24 people to meet up consistently was going to be an issue, and so we split into 3 groups. So we have Dooley, Sly, not sure there, and Macon counties. It also became apparent when Travis and Lacey and I met up that it wasn't really going to work for us to all be so individualized, because the healthcare in the 3 counties is being affected similarly, because the ER closure is hitting all of them. So we changed it to where one of the counties was looking at the background information on all 3 of them. Another group was looking at how the ER closure had affected those 3 counties. The third group was looking at kind of the legislature behind these ER closings and what we could do to make solutions for these counties that are having a hard time getting their people access to health care.
Sly County was named after William Sly, who was the 36th governor of Georgia. That's what Wikipedia says.
Schley County.
Schley County?
Schley County.
Schley.
Sly. Schley.
So just to set the record straight, it's Sly County. I've been hearing a lot of different pronunciations. I think I heard Schley, Skly, some hard case. It's Sly County.
I talked to a medical team there. They work at the Phoebe Sumter Primary Care Center in Chi County.
Have you guys been to the county?
They generally prefer to send their patients to the Phoebe Sumter Medical Center in Americus, Georgia, rather than send them to the Macon County emergency room. They didn't seem to think that they would be overall very affected by the ER closing. There are several other options for Chi County if they need medical attention that's emergent.
So in Oglethorpe there is a part-time health clinic, and it's federally funded, and they serve the local community there. And then there's also another clinic where you've got nurses, PAs, RNs, and a few physicians and specialists as well, and they serve the underserved area.
How would you describe the situation in one word?
Bleak.
Unfortunate.
Well, Dooley County's ER closed in 2001.
My job was to see what the governor is doing specifically for these rural hospital closures. And what we found is that he set up a committee called the Rural Hospital Stabilization Committee, which basically is looking into all the details of why hospitals are closing.
Well, isn't that what we're doing?
Yeah.
Okay, so have they found anything?
Not anything significant. They're basically talking about the same points we're talking about.
So all the people who are employed by EMS and are on their day off are essentially on call all the time.
Found a few concerning facts that we're not sure are 100% yet, such as only 1 physician and about a population of 10,000.
Okay.
We reconfirmed that.
There were a lot of surprising findings.
So we have a comparison of the ER visit rates for 4 different causes for the 3 different counties versus the state. We chose these 4 categories because they would be most impacted by the closing of the ER. The numbers that are on the y-axis is the visit rate. This is not a hard number. What this is a scaled value for age and the population density in the area. So this is a way of normalizing all the data so we can directly compare the state visit rates to the county visit rates, even though the populations are different and the demographics are different in these counties.
Trauma was a really big deal in almost all the counties, but especially Macon County.
We see that Macon County has a higher incidence than the state. Sly is very close to the state average and Dooley is significantly lower.
They won't be able to handle any trauma cases without the ER, but the state rates of trauma are really high in Macon County, so that leaves a gap. Also, ER visits for pain crisis for sickle cell anemia is very, very high in Macon County.
And the very high incidence rates we see in Macon County indicates that there's a systemic problem with the health care for primary care and disease management in this county. This graph shows that all 3 of the counties that we're concerned with have a higher rate of ER visit rates due to major cardiovascular events compared to the state average. This graph shows us that Macon and Dooley counties both have higher incidence rates of ER visits due to diabetes than the state. Schley County is slightly lower, but all 3 counties have high rates. And this may very well be due to the lack of primary care in the area.
Yeah, there's no one way easy solution.
Give nurse practitioners more power, which would mean putting a bill in that says nurse practitioners can do more than they can do right now, because in Georgia they can't really do much.
Yeah.
And then, the potential expansion of Medicaid, because obviously part of the reason these ERs lose so much money is because people go and then they don't pay. They don't pay anything. Where at least on Medicaid, the hospital's getting paid something.
You could do a lot of heavy investments in telemedicine, improve the process behind that and how that works.
I think it's important because these are patients of our state that will one day be serving, and they're being greatly affected by these hospital closings, and they're not getting the care that they need.
Gave us an opportunity to figure out a solution to a problem that can benefit an entire group of people.
I'm glad I could be a part of looking for solutions.
We 3 counties of Georgia are Schley, Dooley, and Macon. Southwest Georgia